Hi, I'm Dr. Julie Lander, and I'm a resident in Cincinnati Children's Hospital. Over the past few months, COVID-19 has disrupted a lot of the things that we do in our day-to-day lives, including some of our doctor's visits. But it's still really important to bring kids in for their well-child checks, and Cincinnati Children's is making sure that we're able to do that safely. So let's talk about what a typical visit might look like during COVID-19. When you first arrive at the clinic, you'll be greeted by a staff member who will ask you some screening questions about symptoms of COVID-19, including cough, chills, difficulty breathing, sore throat, muscle pain, fever, or if you have lost your ability to taste or smell. They'll also take your temperature. Every employee also goes through the same screening process. If you pass the screen, you'll be given a colored sticker as well as a face mask to wear throughout your visit. It is important that adults and children keep their masks on at all times. When you check in, you'll see plexiglass dividers as well as hand sanitizer to use after touching any surfaces. High-touch surfaces throughout the clinic are sanitized multiple times throughout the day. When you get to our waiting room, you'll be socially distanced from other patients and families by at least 6 feet. Additionally, our waiting areas are separated into spaces for well and ill visits, and we'll try to get you back into a room as soon as possible. Our patient rooms are also separated into rooms for well visits and rooms for sick children. Even before COVID-19, every room was sterilized and cleaned thoroughly between visits. Now, you may be wondering why it's so important to bring your child to the doctor even when they're feeling well. There are lots of reasons, but in general, it's because helping kids stay healthy is just as important as making them better when they're sick. So let's review some of the things that we do at Well Child Checks. First is vaccines. COVID-19 is a dangerous, contagious illness that has made a lot of people sick lately. Vaccines can help protect and prevent against other contagious illnesses such as measles and whooping cough. Getting your child their vaccines on time can help protect them as well as preventing outbreaks of contagious illnesses. We also measure vital signs and height and weight on every child to make sure that they are growing appropriately. We also measure their developmental skills to help make sure that they are meeting milestones as expected. And if extra intervention or assistance is needed, we can make those referrals in the clinic. Kids and teenagers are also screened for symptoms of depression and anxiety and other mental illness. COVID-19 and staying home and a lot of the things that have been lost over the past few months has been really difficult for a lot of people. And we can make referrals to counseling or even start medication if needed. Our primary care clinics also offer social support to families. Especially right now, a lot of families are struggling with food and finances. Several of our primary care locations have food pantries in the clinic to help families immediately. Our social workers can also offer support for longer-term problems. In addition, we also offer other services such as fluoride varnish to help keep teeth healthy, safety equipment such as bike helmets and car seats, and testing for hearing and vision, all in addition to your doctor visit. There are a lot of pieces to help keeping children healthy, and we want to support you as we all get through this pandemic safely. We look forward to seeing you at any of our Cincinnati Children's primary care locations.